There are over 17 million people coping with a long-term health condition, such as diabetes, lung or heart disease, in the UK. Long-term conditions are managed through a programme of medication and other therapies prescribed at the moment by doctors. Living with a long-term condition can be hard, as sufferers can often feel overwhelmed.
Initially, diabetes was a problem because I had problems with ankles, acidity, joints, knees, breath. I had to roll off the sofa to get up. I couldn't run upstairs. I couldn't even lace up my shoes. The blood pressure was up, cholesterol was up, everything was out of control. You're like a spinning object. You're out of control. And you look at one problem at a time. That is to bring down the glucose level. And diabetes, eventually, it is a killer. You can lose toes and blindness. And it was on that, after that impact, one takes a step back and says, right, let's get a grip.
With more patients being diagnosed with a long-term condition each year, and with sufferers needing regular visits to their GP or hospital, an even greater strain is placed on the healthcare system.
I've got type 2 diabetes, which is diet controlled and by tablets, and I'm up to about 23 tablets a day. That's the glucophage and the diabetes tablets, high cholesterol. I visit my GP on a 3-monthly basis when they monitor, and if there's any problems which you can foresee, if there's any immediate problems, I can get within a day, 2 days.
With more patients being diagnosed with a long-term condition each year, and with sufferers needing regular visits to their GP or hospital, an even greater strain is placed on the healthcare system.
Well, like any surgery, we have two different sorts of patients. We have those emergency patients who ring up on the morning, they're not feeling well, they have a sore throat, or they're vomiting, or they've broken their leg, and they come in on the day and we treat them for their symptoms. The other group of patients we have are those with the long-term chronic diseases, so we know we're going to see them on a regular basis. So I would say that the workload is fairly evenly divided between those two sorts of patients. The effect on the NHS, of course, is that there's a lot more patients, numerically speaking, because people are living longer. And as you live longer, of course, you tend to start suffering from those conditions that increase prevalence with age. So there are more people to look after. And the way in which we look after them are becoming more and more expensive. The drugs that we're using, say, for Alzheimer's disease or for diabetes, becoming more and more expensive.
With these concerns in mind, the NHS launched its improvement plan in 2004. The plan identified long-term conditions as one of its top 3 priorities and outlined the need for a system that supports patients in managing their own healthcare within their own homes. Of course, there are expert patient groups and community matrons, and these are all options currently being explored. But one company has developed another way of helping the NHS meet their target.
Our long-term conditions management solution is a solution that's essentially based in a call centre environment. And what it does is it initially identifies patients that would be suitable for enrolment in the program. The patient is then enrolled in a management program where you ask them an extensive number of questions over their exercise regime, diet regime, lifestyle, psychosocial status, symptoms, medications, all these kind of things to get a good picture of the patient. It'll increase their quality of life because they'll feel more in control of their condition. They'll understand when they're not feeling well, why they aren't feeling well, and what they need to address that. A patient can cost £5,000, £10,000, £15,000 a year to manage in that kind of environment. But if you can keep them in community and at home, it's much more cost effective for the health service.
To be able to look after all my patients, especially those with long-term medical conditions, comprehensively, is a very difficult thing to do. It's overwhelming, and to be honest, we need all the help we can get to do that. And so that means from the patient and from any other agency that we can use. And so if a centre is set up in order to contact those patients on a regular basis and monitor how well they're doing, their drug usage, the inhaler techniques and all that sort of thing, then I'd welcome that with open arms.
Anything to stop conditions arising, flare-ups, it's got to be a good thing. I usually work with Dr. Haslam. The whole basis of diabetes control is work in harmony with your doctor. He would prescribe and then we can monitor, and there's a condition called HbA1c which monitors the underlying 3 months of your sugar diabetes, whether you're going off track or you're on course. I've got a passion for gardening now. Doc said that you've got to do some exercise. It's the adjustment that you've got to be focused on. To manage my own condition, it takes discipline. But if there's any external methods that are coming on stream, I would be up for them.
So it seems like both patients and GPs are beginning to recognise just how much patients can contribute to their own health care.
So many patients who have long-term conditions are elderly patients, which means that they not only have one long-term condition but might have a combination, a number of comorbid conditions. That means that they're on a number of different medications, and it can get very confusing for a patient. A simple conversation on the phone can identify that they have too many medications, and that if they're taking 5, 3 might suffice or something, and you'll work in consultation with the GP and the pharmacist to identify streamlining those medications, maybe getting it down to 3, maybe just twice a day, so she understands, when she's busy taking those medications, that's actually going to do the benefit.
Equally as important is that they'll get the encouragement and the morale boosting, and that sense of lack of isolation. Somebody else is joining the team in order to prompt that person to do all the right things and feel better and become empowered, really, to look after their own condition in conjunction with the rest of the team, who are on hand if necessary. Everybody wins. I win because my workload is decreased. The patient wins because they feel better for longer. The hospital wins because they don't have an acute admission. So everybody wins if we can do that.
You're the only person that can control the long term. It's down to you whether you progress it or you stabilise it. It's in your own hands. End of story.
Clinical Solutions, bringing decisions to life.